Title of the topic is Correlation between Optic Nerve Sheath Diameter and CT Severity Scores in Traumatic Brain Injury. Traumatic brain injury is a major cause of morbidity and mortality in developing nations. Road traffic accidents account for approximately 60% of traumatic brain injury cases, followed by falls and acts of violence. Timely evaluation of intracranial pressure is critical in traumatic brain injury management to prevent potentially fatal outcomes. Key predictors of traumatic brain injury severity and outcomes include optic nerve sheath diameters, optic nerve sheath diameter by eyeball transverse diameter ratio, Rotterdam CT score, Helsinki CT score. These predictors are used as tools to triage and assess injury severity in traumatic brain injury patients. The optic nerve sheath diameter and optic nerve sheath diameter by eyeball transverse diameter ratio have recently become non-invasive alternatives for measuring and monitoring intracranial pressure. The Rotterdam CT score and Helsinki CT score are commonly used tools for evaluating patients with traumatic brain injury. These metrics serve as initial triage tools for predicting intracranial pressure and traumatic brain injury severity based on the first CT scan. Ultrasound can be utilized subsequently to monitor changes in intracranial pressure over time. Aims and objectives: to examine the correlation between optic nerve sheath diameter and optic nerve sheath diameter by eyeball transverse diameter ratio with Rotterdam and Helsinki computed tomography scoring systems in patients with traumatic brain injury. Methods and materials. The sample size was 100. Study design was prospective analytical study. Data source were patients above 18 years of age who undergo non-contrast CT brain within 24 hours of traumatic brain injury. Exclusion criteria were patients with pre-existing intracranial space occupying lesions or history of significant prior brain injury, previous orbital, ocular, or optic nerve disease or surgery that could affect the accuracy of optic nerve sheath or ocular diameter measurements. Analysis: the optic nerve sheath diameter and the optic nerve sheath diameter by the eyeball transverse diameter ratio measured from the initial CT scans were compared with the Rotterdam and Helsinki CT severity scores. Rotterdam CT score. They were based on basal cisterns. If it was compressed, it was given a score of 1, obliterated 2. Midline shift, if less than 5 mm, then 0, more than 5 mm, 1. Epidural mass lesion, if was present, then 0. If it were absent, then 1. Intraventricular blood or traumatic subarachnoid hemorrhage, if was absent, 0 and present 1. A total score of these with plus 1 was given as the final score, and the range is between 1 to 6. Helsinki CT score, it was scored based on the mass lesion type. A subdural hematoma is given a score of 2, intracerebral hematoma also a score of 2, epidural hematoma -3. Mass lesion size, if the volume of the hematoma is more than 25 centimeters cube, a score of 2 is given. Intraventricular hemorrhage score of 3. Basal cisterns, if it is compressed, 1, obliterated 5. A total sum score could range anywhere between -3 to +14. The optic nerve sheath diameter was measured 3 mm posterior to the eyeball, and the eyeball transverse diameter was determined using electronic calipers. Rotterdam CT scores and Helsinki CT scores were evaluated. The optic nerve sheath diameter and the optic nerve sheath diameter by the eyeball transverse diameter ratio were analyzed for their correlation with Rotterdam and Helsinki CT scores. Results were obtained. A graph here represents the average age of the subjects that was between 39.9 plus or minus 12.7 years. The majority of the subjects were male, as indicated in this pie chart here, with most of them falling between the age range of 30 to 50 years. On the left, the bar diagram here is showing mean optic nerve sheath diameter on the right and the left side. The right mean optic nerve sheath diameter is marginally higher than on the left mean optic nerve sheath diameter. This difference may indicate like a small asymmetry in the optic nerve sheath diameters between the two eyes, and such differences could be due to physiological or related to measurement variability. On the right, the bar diagram shows the mean optic sheath nerve diameter by the eyeball transverse diameter of the two eyes. So here both the ratios are very close on the right and the left with minimal difference between the two means. So there was a positive correlation between the optic nerve sheath as well as the optic nerve sheath and the eyeball transverse ratio with the Rotterdam and Helsinki CT severity scores with the predictive value of less than 0.01. The optic nerve sheath diameter, the ratio of the optic nerve sheath as well as the eyeball diameter, Rotterdam and Helsinki CT severity scores were identified as independent parameters for predicting the outcome in traumatic brain injury cases. The study aimed to evaluate the correlation between the optic nerve sheath diameter and the optic nerve sheath with the eyeball transverse diameter ratio on initial CT scans with the Rotterdam and Helsinki CT severity scores. CT imaging is the preferred method for assessing head injuries. Optic nerve sheath diameter provides an alternative, indirect way to measure the intracranial pressure. To account for discrepancies and age-related variations in optic nerve sheath diameter, the ratio of optic nerve sheath as well as the eyeball transverse diameter was calculated. The Rotterdam and Helsinki CT severity scores were calculated by assigning values to the respective components. The study included 100 subjects, of which 70 were male and 30 were female. Road traffic accidents were the leading cause, accounting for approximately 60% of the cases. A positive correlation was found between the optic nerve sheath diameter and the optic nerve sheath by the eyeball transverse diameter ratios with the Rotterdam and Helsinki CT severity scores with statistically significant results. The mean optic nerve sheath diameter was 5.85 and the mean optic nerve sheath by the eyeball transverse diameter ratio was 0.21. This is a representative case showing the right and the left optic nerve sheath diameter being 6.1 and 6.2 respectively. The eyeball transverse diameter being on the right 24.3 and on the left 24.4 mm respectively, and the ratio is being 0.25 on both sides. According to the Rotterdam and Helsinki CT severity scores, the cisternal spaces are completely obliterated with a midline shift of more than 5 mm. No evidence of extradural hemorrhage, but there is subdural hemorrhage as well as intraventricular hemorrhage and subarachnoid hemorrhage, giving it a score of 6 according to Rotterdam and the Helsinki CT severity score of 12. This is another case with the optic nerve sheath diameter on the right and left being 5.8 and 5.7 millimeters respectively, and the eyeball transverse diameters being 24.5 and 24.3 millimeters respectively, and the ratio of the two being 0.23 on both the sides. Based on the Rotterdam and Helsinki criteria, there is no significant midline shift. Basal cisterns are mildly compressed with no extradural hemorrhage. There is subarachnoid, subdural, as well as intraventricular hemorrhage, giving a Rotterdam CT severity score of 4 and Helsinki CT severity score of 8. In conclusion, the optic nerve sheath diameter and the diameter of the optic nerve by the eyeball transverse diameter ratios should be documented in every initial CT report for traumatic brain injury cases, as they may serve as an important radiological tool in assessing the severity of the injury and predicting the intracranial pressure. These non-invasive parameters, when measured on the initial CT scan, could assist in making timely and appropriate interventions, potentially reducing mortality associated with elevated intracranial pressure. Thank you.